views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of Bronxnet or the program underwriters.
Senator Rivera is on his way to Albany today, so he won't be able to attend until 4:30. So things will be a little reversed in terms of order, but I think we'll be able to get through it all. The first speaker is Assemblyman Gottfried. Is he here yet? Has he arrived? I don't see him. Well, perhaps we can go to, I noticed that Alessandra Biaggi is here, our state senator. Senator Biaggi would be, is the state senator for the 34th Senatorial District, representing portions of Bronx and Westchester. She serves as chair of the Revived Ethics and Internal Governance Committee. In addition, she serves on several committees, including the Senate Health Committee. In addition to her accomplishments on sexual harassment, which are very important in the workplace, during her first term, Senator Biaggi championed the passage of the Healthy Terminals Act, providing thousands of airport workers with access to affordable health care. The senator will tell us why she supports the act. Senator Biaggi.
Hi there. Can everybody hear me okay?
Yes.
Oh,
great.
Good. Okay, hold on a second.
Welcome. Thank you so much for coming.
Thank you for having me. And also thank you for talking about this very important topic, which I'm sure is on the top of everybody's minds because we're still in the middle of a pandemic, even though I'm hoping that this is the last of it, although we don't know that yet, so I can't say for sure. But thank you for having me, and to everybody here, and to just really the Northwest Bronx indivisible community for continuing to have this discussion, and a lot of really important discussions that I think push leadership and push leaders in the state to do the right thing in moments that there is urgency around issues. Excuse me, I'm not sick. I'm very grateful also to all of you and to my colleagues in government. I'm looking forward to hearing from Assemblymember Gottfried, who for many of you may or may not know, this is actually his final term in the assembly. He is the longest serving assembly member in the history of the entire legislature. And so I'll leave that to him to talk about if he so chooses, but we're going to miss him. I'm really going to miss him. And a lot of the reason for that is because he's really served as a mentor to me and someone who has really given me a clear runway of understanding Albany in times when it's very infuriating. I'm looking forward also to being with my colleague, Assemblyman Dinowitz, and also Senator Rivera when he joins at 4:30. 2022, so let me just jump in really quickly and just tell you very briefly why this bill is really important to me and I think to also others. So 2022 actually marks the 30th anniversary of the New York Health Act. I don't know how many of you know that. And it marks an anniversary at a time when we have absolutely witnessed in this third year of the pandemic, a ravaged and destroyed healthcare system, not sustainable really to have dealt with this pandemic, even though we are dealing with it every day. But really the stress and the just lack of preparedness, I think, that not just New York, but the whole country, unfortunately, has experienced. And so because of that and other reasons, it's very clear to me that it is really dangerous and damaging to essentially put Band-Aids over some of the problems that we've seen. We have to really think about how we can reconstruct and transform our healthcare system, and in an effort to rebuild it. And obviously the New York Health Act does that. I think that we as a body and as leaders cannot continue in a system that perpetuates inequality. This is a consequence I know that a lot of us in the legislature who represent the Bronx and the 5 boroughs understand, unfortunately, too well. And really that understanding comes from a bigger, broader picture of New York, where millions of New Yorkers with healthcare coverage every year go without needed healthcare because of cost or because they suffer financial hardships. And just being insured is not enough, just to be very clear. You can have insurance and still not be able to access the care that you need. And then really just a few months ago, I think this was underscored when it was reported that 50% of all Americans carry medical debt. So there's many components to this. And I think this is perfectly tied with a bow when we think about this issue as a moral obligation to address, really, there are hundreds of thousands of New Yorkers that are also uninsured, even though our percentage of insured New Yorkers is very high. In addition, and my penultimate point here is that the for-profit healthcare system really is set up as a perception of saving lives, but frankly, what it does is actually costs lives, with health insurance executives who really have lined their pockets and not put people first. We saw this with immunity in the budget in 2020, which unfortunately affected those who live in nursing homes and assisted living facilities in a way that was grave. I believe it's unacceptable. Many of my colleagues believe it's unacceptable. And really at that point, and frankly now, I don't believe that the for-profit healthcare system will ever really have a plan to enact universal healthcare in New York, because I don't think that they will ultimately support it. But I don't think that that ultimately matters, because I know that since we have California as an entity that is really taking the charge on this issue, and also because we have a gap in our federal government to enact universal health care, New York State has an incredible opportunity, and now a sister state across the country, to be able to follow. So I think that despite the fact that it's an election year, and despite the fact that you all might be told, well, it's an election year and we can't do big, bold things, that's not really true. And also we have to continue to push to make sure that we actually have a comprehensive healthcare system this year and in the years to come, because we are losing people every single year to the fact that they don't have the health coverage that they deserve. So I don't have to say any more. I know that you all know that I believe that healthcare is a human right. It's the least that we can do as leaders in the state.
Thank you so much. That was wonderful. And now we have Assemblyman Dinowitz has arrived, and we'd like to ask him to speak briefly about why he supports the bill. And welcome, Assemblyman Dinowitz. He represents the 81st Assembly District in the Bronx. He chairs the Codes Committee and also serves on the Rules and the Ways and Means, Election Law, and the Health Committees. He has successfully fought for tenants' rights and protections, authoring the COVID-19 Emergency Eviction and Foreclosure Prevention Act, the vaccine mandate, the National Popular Vote Interstate Compact, and a landmark bill against human trafficking. His office is best known for constituent services. It is my pleasure to introduce Assemblyman Dinowitz.
Thank you very much, Helen. You convinced me to vote for me after that build-up, so thank you. It is really good to be here today. I should start by saying I got elected a while back, to say the least, in 1994, and I have been a supporter of the various versions of the New York Health Act that entire time. And we actually passed it a couple of times in the Assembly, but it's gone through an evolution. But I think if there's one thing that everybody should have learned these past few years, is that there is such tremendous inequality in this city, in this state, and the country, and relating to healthcare. We saw the early outcomes during the pandemic. And if nothing else should convince people that we need to do this and do this now, it is what's happened over the past 2 years during COVID. it is a national disgrace that we don't have this on a federal level, but at least we should be doing this on a state level. And there are those who will say we can't afford it because of the huge cost involved. And there is a huge cost involved. But what they don't say is that the amount of money that people would save if this became a reality, I believe outweighs whatever cost there is. So in terms of economics, it makes sense. But I think most importantly, in terms of making sure that everybody, every last person has access to quality health care, this is the way I think we need to go. You know, we've done over the past 2 years, we've done a number of bold things in our state, and this should not be one of those things that we don't do. I know the fight's been a long fight, and I just want to say thank you to Helen Krim, who I know has been our most, although there are many, has been among our most vocal advocates for the New York Health Act in our community, and she's worked so hard on it. But I also have to pay tribute to Dick Gottfried, because Dick Gottfried has devoted his life to getting this done. He understands the impact that this is going to have on people in our community and throughout the state. And he has devoted his career to this. You know, Dick has been, I lost track, but I'm pretty sure he's been chair of our health committee for somewhere around 35 years. And I'm hoping that this year, which will be his last year in the assembly, his 52nd year, is the year that we can do this. There is nothing I can think of that will have a greater impact on people's lives, on reversing the terrible trends of the past couple of years, which is the shrinking life expectancy in this country. There is nothing we can do that's going to have a greater impact than passing the New York Health Act. So I hope that we can get this coalition that we need together this year. And I know there are a lot of good people and groups that have various reasons for not being supportive. So I think it's our job collectively to convince them that they can do this, they should do this. And if we all work together, maybe this year can be the year that we get this done, finally.
Thank you, Assemblyman Dinowitz. It seems that Assemblyman Gottfried has not arrived yet. And we are so tight on the questions and on the time that I think we should just proceed. And so it is my pleasure now to introduce the moderator par excellence in the Bronx, the host and senior producer of Bronx Talk, the borough's flagship talk show on Bronxnet cable television, the man whose reputation as fearless and fair has made him sought after as a moderator for more than 80 political debates. Please welcome Gary Axelbach.
Well, thank you very much, Helen. And I guess like Assemblyman Dinowitz, I would say, well, now I guess there's reasons to vote for me, but now there's reasons to watch me on TV. So I really appreciate those kinds words. But listen, we have a very big job today. There are many more questions than I thought we'd have time for. Maybe now we'll have a little bit of time. I will say good afternoon to Senator Biaggi and Assemblymember Dinowitz, both of whom represent me. And so I appreciate that. And I will just tell you what we'll do is I'll ask a question. And of course, if Assemblyman Gottfried was here, we would allow him to respond as well. But each of you can respond. I mean, you know, it's not a debate. It's a matter of just providing the community with information. And so we're just going to get started. I'm just going to ask the questions. I guess we'll go alphabetical order. So Senator Biaggi will be first, and then the next question, Assemblyman Dinowitz will be first. And then you both can respond. Try to limit your answers time-wise. We looked at a minute and a half, and they were going to show cards like green for 30 seconds left, yellow. Who has the cards? Somebody has cards. Oh, there, Christine does. So she's got the red, well, it'll be green, yellow, like my shirt, for 15 seconds, and red at the end of 1:30. I don't expect we're going to have big problems on that regard. as opposed to when we do debates together, and you both know that all too well. All right, let's just get to it. Senator, nice to see you. Nice to have you with us for this very important event. And this goes right to you and your colleagues. How many of the co-sponsors are answering the call to be active co-sponsors and strong advocates for the Health Act bills? And which areas of the state should advocates concentrate on? I mean, is New York City a problem? Are we looking at Hudson County? Are we going all the way up to Buffalo? How do you see the landscape of advocacy, starting with your colleagues?
Thank you for this question. So first of all, just for everyone to be aware, there are currently 32 Senate co-sponsors, including legislators from both upstate and downstate. Obviously, I'm sure you all know this fact that 32 Senate co-sponsors is the exact number that you need to vote to pass the bill on the floor so that it actually goes through and can ultimately, after the assembly or before the assembly passes the bill as well, go to the governor's desk. And so obviously I'm only speaking for the Senate, and I do look forward to Senator Rivera being on. But what I will share is a little bit of what we've been up to in the past year, a little bit of inside baseball, and then end with like, what can we do? And I'm keeping my eye on Christine. I see you, I pinned you actually, so I can make sure that I keep my time quite well, okay? And so the co-sponsors, especially the group of progressives in the conference, are very vocal and dedicated to this issue, so much so that last year we got together and we requested a conference on this bill. When I say a conference, what I mean is that when right before we vote or after we vote, getting together as a body to be able to discuss what are the questions, what are the issues, what are we hearing, what has to be changed. Because there were so many people who wanted to talk, it actually took more than one conference to go through it, and we still didn't finish. And so my experience in the Senate has been that everybody has played an active role, even those people who are actually still on the fence or questioning it. Thank you, Christine. And so I think the attention and the focus should really be on the members of our conference and our party that are not currently co-sponsors of the legislation, because at the end of the day, more people on the bill, even though we already have the numbers to pass it and it would pass with those 32, make it stronger and also allow us to withstand some of the opposition that we already are going to get and already are getting. And so that's what I would just say there, that those who are not already on the bill should be the ones that we focus on.
You know what? I'm going to break the format already. I've got to ask this follow-up. Are the objections in the Senate strictly limited to political lines? In other words, Democrats say yes, or is there really a mix in acceptance of this concept?
No, it's not party lines, and I don't even see this as political. What I see it as is there's a few things. First of all, not every single person has read the bill through and through. Number one, right? That's just the reality. Number two, there have been amendments to the bill that not everybody has been familiar with. I think at this point, probably we're at the point where everybody knows the amendments that have been made, including the addition of long-term care, because that's obviously very important. Number three, I think that there are members who are concerned about certain aspects of labor and labor unions that are against the bill. DC 37 is, I believe, and Assemblymember Dinowitz, correct me if I'm wrong, and I, again, will defer to Gottfried and to Rivera when they get on, but my understanding is that DC 37 has strong opposition to this bill. So we, as an entity, it's really up to us and incumbent upon us to first start with our own party, because I think that's important to be as strong as we can. And then honestly, if ever there is an opportunity to work across the aisle, I'm not opposed to it, but I don't see it as being the top priority. And I don't think that this is something that Republicans really care about. I feel like they're in fact very much opposed to this. So I don't see it as necessarily political in that way. I just see
let's let the Assemblyman talk firsthand about his colleagues in the Assembly.
Good.
Well, I will start by saying that I don't think any Republican supports this bill. I don't think they're likely to support it. So I know people say we got to be bipartisan, but that's just not happening. So forget about them. So in each house, we have a substantial majority, a little over 2/3. There are people who are on the bill, but just because somebody is on the bill doesn't necessarily mean they are 100% committed to actively supporting a particular version of the bill. So I would say in the first instance, we have to work on making sure that everybody who has co-sponsored the bill is going to strongly support the bill. Second, yes, we should work on getting additional sponsors, but the bill has been around a while, and if you're not a sponsor of the bill, there's a good chance you're not for the bill, but that doesn't mean we should give up on them. Plus, we get new members. We just had a special election. We have a new member in a couple of weeks. We'll have a couple of more new members. So it's a constant effort to try to replenish the number of sponsors. But it is true, and it was just alluded to, there are very strong opponents to the bill, particularly among some of the public unions, public employees unions. And I think it's largely based on the fact that these unions have sacrificed a lot in their negotiations. They have what they consider great health care coverage, and they got that coverage during labor negotiations, sacrificing wage increases in many cases. So that could help explain some of the opposition to the bill, but I think that's something we can work on. And I think, personally, that if they were part of the New York Health Act, which they would have to be, and their past sacrifices were dealt with, then perhaps they can get on board. But I think it's really important to have all of labor behind this bill, because I think it's going to be very hard to get this done unless we have a united front among our friends in labor.
Well, one thing I neglected to mention, these questions have been submitted by many of the sponsoring groups here. That first one came from NYCD 16 Indivisible. Next question submitted from the Caring Majority by Zahav. I hope I pronounced that right. Assemblyman, this probably doesn't require a long answer, but the question is 90% of home care workers are women, 80% are people of color, and they're being paid $12.50 an hour on average. Do you support fair pay for home care? You can do yes or no, or if you want to add a couple of sentences, go right ahead.
Well, I'm always happy to give a long answer, but I'll give a short answer. Yes, I do support fair pay, whether the workers are women or men, whether they are people of color or not. Everybody should get fair pay, and they are underpaid, and we have to do something about that.
Senator?
Yes, and I'm a co-sponsor of the bill to do that. And one positive thing is because we have a new governor who is actually committed to getting work done without drama, which is really amazing. She has actually placed in her budget, as well as state of the state, that this is a priority. So I think we can not count our chickens, obviously, because we don't like to do that before things are done. But I do think that this is a priority this year. So I think we're going to see this happen.
Senator, we'll stay with you here. Let's see, Megan McLean from the Caring Majority, among others, submitted variations of this question. So this is the basic fundamental question. Senator, first you, and then the Assemblyman, please explain the difference between what current health insurance or long-term nursing insurance offers versus what advantages the New York Health Act would offer.
Sure. So, current insurance, current insurance is what we know what it is, what it is to be. It's on the free market. You get to select it. It has a cost. It has co-pays, deductibles, and premiums. Just because you have insurance, as I mentioned in my opening remarks, does not mean that you are not fully insured for all of the things that you need. With that particular private insurance issue, we know that prescription costs are really not in our control. We cannot determine to negotiate with pharmaceutical companies the price of a certain pill, prescription, or drug that is necessary or life-sustaining. When it comes to the New York Health Act, even though there's a lot that I can say about this, the first and most important thing is that there would be no network restrictions, there would be no deductibles, there would be no co-pays. The coverage would be publicly funded, and every single New York resident would be eligible to enroll regardless of their age, regardless of their income, wealth, employment, or other status. In addition to the things I've just listed, the benefits also include comprehensive outpatient and inpatient medical care, long-term care, which is one of the most important things that we can focus on as human beings. Again, whole conversation in and of itself, primary and preventative care, prescription drugs, laboratory tests, rehabilitative dental, vision, hearing. All of these benefits are required by current state insurance law provided by the state public employees package, family health plus, child plus, Medicare, Medicaid, et cetera. Here's like the crux, and you can debate me on this, on whether you think this is the most important piece. When we say single payer and when we say New York is the entity to provide health insurance, what we're really saying, and this is, I think, the most important part, is that New York State is the sole entity in this healthcare structure that negotiates on our behalf, which means that it is in New York State's best interest, I see my time, to actually get the lowest cost for all of the things that I've mentioned. And I think that that makes New Yorkers strong.
Both of my great-grandfathers have been a part of that study. My roots in environmental health come from my great-grandfathers. They were sharecroppers, and then later they were
not dealing with any of that stuff with the bureaucracy, the expensive bureaucracy that it costs to run our healthcare system. And that's why I believe it'll actually be cheaper to do this despite the expenses involved. It's simple, it's cheap, and everybody will be covered. That's why we got to do this.
I want to just jump in and do one thing, and that is thank my friends at BronxNet Television. They are carrying this live. I see some of them are on the Zoom here, but I know that's just because they're monitoring what's going on. But that's the kind of community cooperation that you'll get with BronxNet, and that we need for something like this. So I really appreciate their support of this very important event. Assemblyman, let's see, your camera kind of went haywire. I was going to ask you a question.
No, it just fell. I'm fixing it.
All right. I was going to ask all the people in the audience to raise their hands if they never got a bill that made no sense from a healthcare provider. All of a sudden, everybody, really, you never got a bill that made no sense? What can I tell you? All right, Assemblyman, let's start with you here on this one. This comes from two environmental groups, Victor Davila of the Point CDC, that's over there in Hunts Point, of course, and Jack Gorman of Diana. Assemblyman, Bronx residents are exposed to poisonous and dangerous pollutants causing long-term health impacts. What do you think the primary obstacles are that hamper other legislators for acting on clear remedies like the CCIA and the New York Health Act to rapidly approaching problems like future epidemics and disasters? I guess the implication there is that we get it worse, yet they're not moving as quickly as we are on things like this. What actions can you take to convince Democratic colleagues that the New York Health Act is the solution we need to prevent these kind of epidemic disease spreads and reap cost savings in the future?
I will talk politics about this because that's what it is. I think there are some legislators and others who are concerned that their constituents will be very angry at them if they do anything that's going to allow them to be accused of raising taxes. I think that's been one of the biggest reasons why there are those who are concerned about the CCIA, about putting $15 billion necessary dollars into battling climate change. And the same thing is true with the New York Health Act. We saw the results of the election last November on Long Island, for example. And that's just one example where people were defeated because of things that weren't necessarily true. One thing I'm certain of is that in parts of our state, such as Long Island and other areas, people are very worried about being painted as high tax people. And to accomplish, whether it's the CCIA, whether it's the New York Health Act, we're talking about spending money we'll spend money and we'll basically make money back and then some. But the fact is, we will have to spend money. Taxpayer money will have to be expended. And it's a political issue, I think. And we have to try to overcome that. We have to be able to convince people that by doing these things, we're going to be much better off, and it's not going to, in the long run, really cost.
Okay, thank you very much. Now, did we lose Senator Biaggi? I don't see her.
No, I'm here.
I don't know. We lost you there for a second. Okay, so Senator, your thoughts about the connection between environmental issues in the Bronx and the potentials that these acts provide or could provide.
Yep. So I feel quite urgent about this issue, especially as you tie it to climate justice and what's going on with our planet, because frankly, at the end of the day, if we don't have a planet, all of the issues that we're talking about don't matter because there won't be a place to live. And so the Bronx has been known to be notorious for people who have all of the comorbidities that caused them to be more vulnerable and susceptible to COVID-19, and frankly, in the future, to probably more pandemics or epidemics that we will face because that's the world that we live in. And so when we think about health as not just do we have access to healthcare, but do we have access to healthy food? Do we have access to healthy air? Do we have access to clean water? Do we have access to healthy housing? It's all tied together. And when we think about like, why are people not feeling the urgency, or why is there not, a greater push? I think it's because people often feel more comfortable or safe solving issues step by step. And so like, that's a very true human fact, as opposed to making, or taking large initiatives that bring about change. However, we all know here, every single one of us, that incremental steps that we've taken to address climate as well as healthcare issues, it's not that they're not working in and of themselves. We've done a lot. It's not enough. It's not enough comprehensively. It's not enough collectively. And frankly, it's not fast enough. And I know that that sounds sometimes very radical to people, but at the end of the day, because we in the past 50 years, 60 years, have not really taken on the issue of climate justice, what we are now seeing is a compounding effect that really we are not going to be able to catch up to. And so I think that for me, and I really do speak for myself here, for me, every time that this issue of healthcare as well as climate justice come up, I am always reminding my colleagues about the fact that the Bronx has been the last with health outcomes every time that we have a survey on that, 62 out of 62, that it doesn't mean that if the Bronx gets better with their health outcomes, that we want Queens to be worse or the Hudson Valley. That's not what we're hoping for. But the point here is that the urgency that I have is also directed at my leadership in the Senate about the cost of not acting with so much greater fervor, because we will literally not be able to deal with the problem because it will become so big. And obviously, I'm leaving out a very significant piece here. And I know that I'm like running on time.
You're well over, yes.
I know, but there's two more things to say.
All right, we'll give you a chance. And Assemblyman, if you want more time, of course we can do that.
The private industry.
We're not debating each other, don't worry.
That's right.
Okay. The fossil fuel industry and the healthcare industry, specifically the private health insurance and private hospitals, this is not to their best interest, right? Because the less people who are sick, the less people who are going to the hospital or going to a doctor. And so it's all connected. And I don't say that from a cynical place. I say that from a very honest and earnest place. But the reality is they're interconnected. You cannot untangle them. And we have to act so quickly and use every piece and ounce of power that we have to get this done. We just do.
You. I know, but what I do appreciate, aside from going overtime, which does hurt my sensibilities is your passion, and that's quite evident. I guess you get the next question. I love this question. It's so simple, but it's so fundamental. The next question was submitted by a disabled constituent concerned about eligibility requirements under Medicaid. And so, Senator, you're first. Would Medicaid disappear if we had the New York Health Act? I know this is of great concern to many, many people.
So my understanding is that Medicaid would not disappear. Medicaid is a federal stream of money. And so this is more in the weeds than I am probably capable of doing but at this moment. But here's what I will say about this. Depending upon the funding stream that we end up on, and Assemblymember Dinowitz talked a little bit about this with taxes. When we think about how we will pay for this, depending upon the funding stream that we end up on, it doesn't necessarily mean that Medicaid will be cut off or that we won't have Medicaid continue to subsidize or be part of our ability to have the New York Health Act. However, obviously, many people do not want to see Medicaid go away or see Medicare go away. This is a huge, I remember the first time I talked about the New York Health Act, and I said, well, Medicaid and Medicare, it won't matter long-term because we'll have another funding stream, and it really freaked everybody out. And so I'm not saying that here today, but that is the extent to what I know, is that the funding stream that we have, or we will be able to have through the state of New York, will be able to cover this cost. And also, it doesn't necessarily mean that Medicaid will disappear, but local governments won't pay for Medicaid as a result, my understanding is. And I think a really important point here is that we want there to be a separate funding stream, because part of why this bill is so attractive to so many people is that it is not tied to employment. And so when you are not tying healthcare to employment, you are not requiring people to have to stay in their jobs. You are not requiring people to have to stay in unsafe working conditions. And also you allow people to have the liberty and the freedom to be able to have the careers that they want without feeling a burden of, if I leave my job, I won't have health insurance.
Got it. Assemblyman, Medicaid, what do you think?
I think that nobody would be adversely impacted whatsoever under the New York Health Act vis-a-vis Medicaid. I think that those who are part of the disability community would not be adversely impacted. It would be the exact opposite. The fact is, it's about eliminating disparities, inequalities, bureaucracy, and there'll be a big increase in costs to the state, but more than counteracted by the decrease in costs to people. So as far as Medicaid, it's not going to really disappear, at least from the feds. We do get funding, Medicaid funding through the state, but that's not going to be necessary anymore. So I think that we're going to create extraordinary efficiency, and it's really incredibly exciting if we can get this done. And those who are concerned about the issues that were just raised, I don't believe should be concerned in the least.
Thank you very much, both of you. I do want to, in between questions, thank the people who put this together. We have almost 100 people here, and I can't think of anything more important on a Sunday afternoon. So it's already been mentioned, thanks to Helen Krim and Danny Rennells, who's doing a lot of the tech and everything else. We appreciate their input. The timekeeper, as you know, is Christine Stanfield. And Ira Bagelason has also done a great job in helping set it up. Thank you. Moderating the chat is Carol Gross, and the Facebook moderator is Colette Sweat-Nicky, and I really want to thank them. I also, again, want to thank my friends at BronxNet. Not only there are 100 here, there are probably many more on Facebook. Let's see, this goes to you, Assembly Member. Comes from CROC, the Cross Union Retiree Organizing Committee, formed to stop the effort of New York City to move municipal retirees from public Medicare health insurance to a private for-profit Medicare Advantage Plus plan. So what are DCEs, and how would the plan to privatize Medicare through DCEs, which are direct contracting entities, affect New Yorkers who have traditional Medicare as their insurance. So we've talked about the effect on Medicaid. Here we are for Medicare.
Well, there's been I guess, a disagreement as to whether or not this is a good thing or a bad thing. I'm very concerned about it, but some of the unions that are involved with this issue disagree with, I guess, the premise of the question. So there is no agreement as to what the best way to deal with this is. But I would be concerned with what's being, I guess, done now. But again, if we do the New York Health Act, that's probably something we wouldn't even have to worry about. So yeah.
Okay, that's fair enough. I think that's a satisfactory answer for a lot of the people who are watching. I can tell by the way they look. Like me, they're a little bit old enough to get Medicare. Nonetheless, Senator Biaggi, what do you think?
I concur. Actually, I don't feel like I need to duplicate that for the interest of time, to pull back our time that I went over.
Well, we were concerned with 3 elected officials. We might have too much material. Now I think we'll fall under, and maybe we'll be able to answer some of the chat questions later on. So this, I guess, would be for you, Senator Biaggi. Kroc agrees that the current system is broken and unsustainable, and that the New York Health Act is the answer. That is the Cross-Union Retiring Organizing Committee. Will you sign their letter asking the mayor and the controller to stop the switch to Medicare Advantage plans and let us keep the health care coverage, Medicare, that we were promised during our many years working for the city of New York? From what you said, I'm assuming the answer is a simple yes.
The answer is yes.
All right.
I've read it, and thank you for sending it over.
I don't want to rewrite the book here. Assemblyman, your thoughts on that?
I just want to make sure that whatever is done helps people and doesn't hurt people. So I think both of us would want to be assured that that would be the outcome that's most desirable. And, there's some dispute on that right now.
Okay, thank you. Assemblyman, this question comes from Michael Lasili, a supporter with the New York State United Teachers Union, and Shoshana Hershkowitz from Brookhaven Democratic Progressives and United University Professions, all supporters of the New York Health Act. The question is, and we've talked about unions, some unions claim that moving to a single-payer healthcare system like the New York Health Act disrupts pre-negotiated coverage plans. What will it take to demonstrate the economic and public health benefit of NYHA, is that what we call it, the New York Health Act, to those union leaders? And is anything currently that you're aware of being done to educate those union leaders? It's already been brought up, but now let's focus on it a little more.
Well, I talked about it earlier. The public employee unions that have negotiated wonderful healthcare plans for their members certainly don't want the sacrifices they made in terms of wage increases, which they never got, to go to waste. And I don't blame them one bit. They gave up, X percent in order to make sure that their members had healthcare coverage. So this is really part of the mix of negotiations that have to take place. I know that Assemblymember Gottfried is, he's in the middle of all this, obviously. We have to make sure that everybody is made whole, that we don't want losers in this. We want everybody to be a winner. And so whether it's teachers or DC 37 or others, there's no reason that their previous sacrifices should cost them now if we pass the New York Health Act. So we have to make sure that that's all part of the mix.
Do you think, as written now, the Health Act would need to be revised in any form to incorporate even some of these concerns or other concerns about unions? And then we'll let the senator answer this question as well.
Well, I mean, the Health Act hasn't passed, so it may be that there will be necessary changes made to it in order to get a majority in both houses. I mean, I'm not going to negotiate today, and it's not my role to negotiate it in the first place. But I think that we have to make sure that we have everybody on board, including all segments of organized labor.
Right. It'll be interesting. Senator Rivera, Gustavo Rivera, who is the chair of the Senate's Health Committee, will join us at about 4:30. He's currently driving down from Albany. And once that happens, maybe he can shed some light as well. Senator Biaggi, your thoughts on this?
Yes. So there's a few things I have to say about this. So first of all, the points that Assemblymember Dinowitz made, I agree with. And also, I'm just putting in the chat right now, this is just a list of quotes from last year about who supports it. I will just say this, having as much union or labor support as we possibly can get is always a positive, because we want partners who are in the legislative process with us. And I think that going through the process and really addressing each union's concern, which again, I think Senator Rivera will have a better idea of those concerns more specifically, is and will be the way through this. What I will also say is that NYSNA, right, New York State Nurses Association, and 1199 SEIU are already supporters of the bill. Now, NYSNA, you might already all say, well, of course NYSNA is a supporter of the bill. That makes sense. NYSNA is a very progressive union. They have been very vocal about this issue, but it's not necessarily expected that 1199 would be a co-sponsor on the front end now. And that was it took a lot of work to gain their support. So those are two very big unions who support this bill. And I think that shows at least an opening for others to be able to say, okay, well, we know that these are big players at the table. They have a lot of members. These are people on the front line, and let's have a conversation. So that's number one. The second thing I just want to say is that the new amendments to the New York Health Act actually did make this bill one of the most feminist and also health justice oriented pieces of legislation that we have ever seen. And why that is also important is because we know that a lot of our frontline workers, especially and specifically our nurses, are the ones that are most directly impacted with these issues. And so it's incumbent upon all of us that if we know the bill and understand the arguments, that we also are able to engage with people who are afraid of this passing or don't fully have an understanding of the bill, and then address their concerns instead of making them wrong for having concerns, because it makes sense why people would have concerns.
You know, I wonder, one thing that kind of got passed over in an earlier question that I want to just bring up again. So Assemblyman Dinowitz, we'll start with you. It was asked about which geographic areas in the state might need attention from advocates to help get it passed. Are there geographical pockets where you say, I mean, we realize there are some areas where there may be GOPers who don't, there's just no chance, so don't bother. But are there, let's say, gray areas geographically that some of the advocates can work on to help get this passed that you're aware of?
I'm not sure that the divide between supporters and non-supporters is based on geography. You would think automatically that there would be stronger support in New York City, but that's not necessarily the case, in the sense that, at least in the Assembly, a lot of our members upstate are actually quite on the left politically. I mean, some of them are what we call marginals, meaning that they are Democrats that were elected in Republican-leaning districts, and I think it's a little tougher for them. But we also have people, and I don't have the bill in front of me, but I could look at the list of co-sponsors. I'm pretty sure that we have a good sprinkling of people from throughout the state. So I think we want to do two things. One is shore up the support of the people who are on the bill itself, to try to encourage them to be louder in their support, and then perhaps try to get some of the people who have not indicated that they support the bill to join the rest of us in support of the bill.
Right. Senator, your thoughts on the geography that could be involved in the advocacy here?
Yes. So I touched on this very briefly, so I'm sorry if it got kind of caught up in what I was saying. But on the Senate side, of the 32 co-sponsors, we do have support from both upstate and downstate. So I don't necessarily think that the geography is the most important thing. In fact, to be honest with you, I think a lot of upstate members feel like this is so necessary because they don't have the same level of access even to hospitals that many of us have. And also a lot of hospitals in the past decade have closed upstate, which makes it practically impossible for people to get the healthcare coverage that they need. And there's no public transportation in rural places. Right. And so I could go on, but I won't. But I think something just to keep in mind here is that the more that our leadership hear from you, the more that they also understand what the people we all represent want. It's really important. We have such an opportunity to continue to build the coalition and then to go also cross coalition, right? So earlier, Gary, you mentioned about the CCIA. We know that there's a massive coalition across the state fighting for the CCIA. There is absolutely zero reason why the CCIA coalition doesn't partner up with the New York Health Act Coalition, and the New York Health Act Coalition doesn't partner up with the CCIA Coalition to basically make it really clear that the number of people who are in support of these two initiatives, but specifically the New York Health Act, is actually growing, and that these are people in the districts where we represent. And so our leadership does need to hear from you, and needs to hear from you, I think, often, because there's a limit to how much we can all say, in my district, these are the people who care about it. Here are the groups. Here are the neighborhoods. But if they're hearing that from all of you as well, it just it's like marketing. It's like when you see the same thing over and over again, it starts to say at the top of the list.
Well, I can only tell you what I said or suggested earlier. You know, anybody who doesn't get messed up medical bills right now, I mean, you know, we are all seeing the effects of it. And of course, that's only one aspect of this. Senator, the next three questions come from NYPAN, which is the New York Progressive Action Network. What role would the union play in protecting worker benefits under the New York Health Act? Will there be a role for unions to play in administering care coordination under the New York Health Act?
Sorry about that. My understanding is that there is a health council. There are 6 regional advisory councils that make up the board within the Health Act, and that organized labor is part of it. So the answer is yes.
All right, Assemblyman.
Yes, I mean, I agree. I don't think there's going to be like a separate union thing. I mean, if we get this done, then the unions presumably will have been on board with this, and it'll be one unified system, and again, that's what makes it so potentially efficient and inexpensive.
These questions in a way are linked, so it could be short answers. Assemblyman, how will the act provide health care for the families of people who worked non-union jobs in New York State but retire elsewhere? So I guess they're thinking about people who go down to Florida.
I actually don't know if people outside the state would be covered.
That's
I would
interesting.
think that I don't think I can give you an answer. I can give you an opinion. I think the New York Health Act probably should be for New Yorkers.
Well, somebody on the
But
chat said they are
I would have to
covered,
check
so we can accept
This
that.
is actually
That's very
I'm
generous of
gonna
us
jump in on
then.
this too.
Senator.
Sure. This was actually a question that there was confusion around this too. And honestly, if I was not present for the conversation in the conference last year, I probably would have missed this point, because I wasn't thinking of it as a top priority point to ask, but it's a very smart question. And so my understanding is that with most health coverage, they're like the New York Health. So New York Health is like, this is the option, also covers healthcare services when a member is out of state, whether it's because like they have healthcare that's needed while they're out of state, or because there's another reason, there's another out of state provider. And so that is my understanding. And I think also in the chat, I think I saw somebody say that too, but this is not like this has not been a top point in our conversation, but I do think it will come up more and more. And so to be honest with you, like about 9 months ago, I didn't know the answer to it either.
All right. Senator, this is kind of related to what we've talked about before. This submitted by David Carlson, Chair of Health Justice for NYCD 16 Indivisible. How would passing the New York Health Act affect property taxes and other taxes related to a county's contribution to Medicaid? Specifically, how much would property owners in the Bronx and Westchester save on their taxes, potentially property taxes, when the Health Act is passed?
So good question, because this is this is the question that's on the top of the list of my constituents who do live in Westchester. It's a lot of talk about property taxes, not just with the New York Health Act, but also with education funding, another issue to deal with, new funding stream for. But my understanding specifically to answer the question is that property taxes would actually go down because local governments will not be paying for Medicaid, and that healthcare ultimately then for their employees will be cheaper.
Okay, Assemblyman.
Yes, I believe one of the important features is that right now Medicaid costs are split among the federal government, the state, and local governments. And I think what we will be doing is eliminating the cost for the local governments, which we've, to a certain extent, we've actually done in recent years. But by eliminating that, that could actually have a good impact on property taxes or on other taxes for that matter.
There's a question here that I skipped over, which also came from NIPAN. I guess, Senator, we'll start with you. And this actually, I think I saw them here, that Margaret and Jordan are here, and we talked about it over at so I can promote the Riverdale Y Farmers Market, the Sunday market. We were there earlier today, and this comes from NIPAN, and it's what we were talking about. Please explain the provisions in the bill that ensure a just transition for health insurance workers who will be displaced. There's concern people will lose their jobs if they work for private insurance companies. So, Senator, what are your thoughts on that?
Okay. So my understanding is that, all right, let me just start from the top just so I can lay out how it works and then feed into what we're talking about when it comes to the employees and also those who work for insurance companies. Okay. So healthcare providers, including those that are providing care coordination, are paid in full by New York Health, right? With, again, no copays, no deductibles, et cetera, that go to patients. The plan also creates other fee structures that we don't have to get into at the moment. However, and if there's someone here with a higher knowledge on this, please, I'm happy to be sidestepped so you can answer this. This bill does not eliminate private insurance companies. And so that it just doesn't. And I think the idea that we talk about it that way I don't think it frames it in the right light, because private insurance companies will still exist. They can still exist. And just like the argument for the free market when it comes to private companies, the free market can also compete with governments, and governments are part of the free market too. And so there's an inherent competitiveness that is just part of the process, but at the same time, this does not eliminate private. And frankly, if private insurance was eliminated, I wouldn't be upset about it. So I'm not like a private insurance like cheerleader by any means, but my understanding is that it actually doesn't. Sorry about that. That's my Siri on my watch. That it doesn't eliminate. So it may impact the number of people, but I find that very hard to believe, and that is my limited understanding of that particular question. But again, it's not eliminating it.
Assemblyman?
One of the first questions in my discussions with Assemblymember Gottfried was, what's going to happen with all the people who work for the insurance companies? And it is my understanding that the bill provides for them, I think, in terms of potential, job training, maybe even unemployment. But they're not just, thrown out on the streets or anything. And it's a legitimate concern because we have a huge number of people who do work for these companies, and they won't really be necessary in many cases once this becomes law.
Okay, so that sounds like that's still on some levels up in the air. We'll have to.
I believe that the bill provides 2 years of unemployment for people who are transitioning, plus retraining.
Thank you for adding that. That's a good start. Thank you very much. That's encouraging to hear. We'll start looking at a couple of chat questions. A nice shout out to my media colleague in the Norwood News. Sheila Maloney is, I guess, out there somewhere. She submitted this. Has any cost analysis been done at the government level in terms of the cost? This, I guess, for you, Assemblyman. So has any cost analysis been done at government level in terms of the cost to the state or city of providing social services to help folks with mental health related issues, and whether or not the provision of healthcare to such folks would offset those costs, potentially housing, counseling, drug treatment, et cetera? Assemblyman.
I'm not aware that the government has done this cost analysis. I know that advocates for the legislation have put forth, their estimates that it would cost X amount of dollars, but we're going to save X plus Y amount of dollars, and so on. If there is a government study, I'm just not aware of that study, and I don't think it exists.
Would you recommend that they do one? Sounds like sounds logical to me.
Well, first of all, I think that if and when, hopefully when, this bill really starts moving through both houses, certainly the fiscal committees in the Assembly Ways and Means Committee and Senate Finance have to themselves provide a fiscal analysis of it.
Okay, Senator, your thoughts on that?
Yes. So every bill that has a fiscal impact goes through, as Assemblymember Dinowitz just said, a fiscal analysis independently of each house. So the Assembly would have one as well as the Senate. I actually do think that there is one either in the process or one that Senator Rivera was working on last year. So that should exist. I don't have it in front of me. I was actually just searching for it. However, I think that Senator Rivera, when he comes on at 4:30, would be the best person to know where that's at. But it's part of the process of passing any bill with the fiscal impact, especially one with the fiscal impact as large as this one.
I'm going to insert a question now, straight and simple. I don't know if it's been directly addressed earlier, but I didn't hear it. So this is a question from me. Senator, what are the chances of getting this passed? Are you concerned about it? I mean, for the people in this call, 100 people who are here, it's completely logical and it's way overdue, but obviously it hasn't happened yet. Do you look at 2022 with Democratic leadership in all three positions in the legislature? Do you believe that now this is going to happen? Are you concerned? Or do you want to percentage it? I mean, how do you want to characterize it? And then Assemblyman, the same for you.
Well, I think that with an initiative as large as this one, I am always concerned when we are thinking about the moment that we're in and also the crisis that we face that is literally directly in the center of the healthcare system. And so I know the urgency, I understand the urgency, but I'm always concerned because I just thinking back to the Healthy Terminals Act, which again was a small, compared to the New York Health Act was a smaller initiative, but yet was still a very large undertaking. And when I think about that and I think about like, what did that take? How did we actually get that done? I was told no, just like Assemblymember Hinman was told no, this is not something that's going to pass. It's really, there's a lot of components to it. There's the issue of the private industry, which were the airlines at the time. And like, I don't know, we have a lot going on. And I don't know which one thing made it happen, but the collective pushing of this bill and the rallies and the discussions internally, as well as directly to leadership, both from members, as well as from union, as well as from other organizers, really did make a large difference. And it was repetitive in a way that meant that we didn't talk about it once a week or once a month and then come back to it in 3 months. It was almost every single conference. And so I think that if I just take that as a model and apply it here, if we want this to get done, it is a massive undertaking of organizing effort, because I just think that that's what it's going to take. And so if that means that the ask of all members is to bring it up in every conference, I think that's not an unreasonable ask. I think it's important that we really do that because, again, it has to be consistent. So I'm always optimistic. I also know that large initiatives take massive amounts of focus. And so if this is the number one focus of this year, that's where all the energy should go. I know that it's not. I know that it's also the CCIA, but again, that's why I'm encouraging the organizing to be done in tandem, because I think that that actually gives it a higher likelihood of passing.
I would say that this, based on your words, this particular event is a pretty good foundation to begin to enact those kinds of activities. Assemblyman, your thoughts?
I have generally found, I generally don't make predictions, and I found that my predictions are never wrong because I don't make predictions. But having said that, you never know what's going to happen. I believe it's an uphill fight. There is no question. But sometimes things come together for one reason or another. Sometimes outside influences have an impact. I mean, if the biggest outside influence I can think of in recent years has been the pandemic, I would think that people seeing that so many people did not have health coverage or had poor health coverage, the disparate results of outcomes, that alone should be enough for people to get on board. Apparently, it hasn't necessarily worked that way. So I guess what I'm saying is you never know. Things could happen, but we shouldn't generally leave things to chance. We can't wait for something to happen, because if we're waiting for something to happen, odds are it's going to be a horrible thing that's going to happen, that's going to move people. So I think the bottom line is constant organizing and never letting up. On an important issue like this, you never let up, you never give in, you never back down, you just have to keep working on it.
I guess we will need to ask Senator Rivera the same question. He might be closer to an answer on that. I'm sure he's forever hopeful. Nonetheless, thank you so much. Next question, I guess, for you, Assemblyman. What changes have come out of the legislative work group since the end of the 2021 session? Have there been changes?
Work groups on this you're talking about?
I would assume that's what it is.
I'm not clear on what the question is. Well, 2021 ended about 3 weeks ago. I'm not aware that we've made changes between December 31st and today, but I think discussions are ongoing. I know that certainly Dick Gottfried is, he's never going to let up on this because, I mean, the clock is ticking. But I don't know that I don't think the bill has been amended in the past few weeks.
All right. Senator, are you aware of any changes?
So no, I'm not, as of the last time that the conference came together around this. And also what I will say is that one of the things that I know we are holding on to in the Senate, and I'm pretty sure that there is a work group in the Senate. I'm not part of it, even though I'm on the health committee. However, the long-term care piece of this bill is something that I know has tried to be separated from the bill. That would be a big mistake. And so a lot of us on the inside are also making sure that it stays in the bill. Also, just one side note related to what we were talking about before, which is like, how do we get people to really care and how do we make this actually happen this year? When we talk about this as an issue, and we talk about the private health insurance companies, and also how much money is being spent and who is footing the bill. And I put some of this in the chat. The people who are footing the bill are the people who are most directly impacted by disparate health outcomes. And so when we think about just removing the bureaucracy for them from a private insurance company, there is an estimation that New Yorkers will save $20 billion. Again, these are not, to my understanding, the Senate numbers, but the point is that the efficiencies from the New York Health Act will actually outweigh the cost that New Yorkers are spending every single year on health insurance. And so I think we have to think about, what are we prioritizing? What do we care about? Do we care about the private insurance companies' outcomes, or do we care about the health of New Yorkers? That's the question.
There you go. I have another question I'm going to insert, and we're going to pick a couple up from the chat as well. I guess, I forgot already who had the last one. So Senator, I guess you get this one. Many of the people in this chat and in this Zoom are in favor of, let's say, Medicare for all or some other sweeping federal healthcare legislation. What would happen to the Health Act if, in fact, it's passed? Do you butt heads? Does that supersede, what might happen in New York State? Do we all then have to reapply to some other, let's say, Medicare for all situation? Do you have a sense of what the procedures would be, Senator?
Well, my understanding is that if we had a federal system, that it would actually be sufficient to do the same thing we're trying to do with every single state. So, excuse me, with the state of New York for every single state. What I will also say, and this is a sub point about the federal government and federal waivers. And then also there's been conversations also about ERISA. In order to make this system, and I don't think I perfectly explained this, so I'm sorry about that, but to make the New York Health Act work, existing federal funds, I mentioned Medicare, I mentioned Medicaid, are going to be integrated into the existing system. And the New York Health Act can seek waivers from the federal government to basically allow for the bulk of these funds to be part of the state-based budgeting of the bill, right? And so it's not that the federal government completely goes away from the process. Again, I know I'm answering a different question, but it's important to just keep in mind that Medicaid doesn't just disappear, Medicare doesn't just disappear. It is part of the funding stream for this particular bill. And why that matters is because when we think about the total cost of this bill and we think about how we're going to actually pay for this in the long term and how we can decouple this or take this away from employers or employment and employees generally, this is one of, I think, the most overlooked but also creative ways, because it's not just about raising taxes, it's also about combining what we're already getting into a more efficient and effective system. And so hopefully that gives a little bit more clarity around this topic.
Okay, Assembly member.
I don't really remember what your question was anymore, but I will say this. According to Dick Gottfried, and I trust him totally, 98% of the people in the state of New York would have lower costs, which means 2% would have greater costs. What does that mean? It means that even if their taxes go up because their healthcare costs go down, they come out ahead. And how is that possible? It's not, it's not voodoo economics. It's that the cost, the waste would be eliminated to a large extent. So when I said earlier, we shouldn't look at, winners and losers. The fact is, I guess 98% of the people will be winners here. And that's an A+.
Here's an interesting question that came through the chat, and I know I've done a lot of work with the various medical educators associations and trying to get people of color to become doctors. So here's one question is, will the Health Act help fund some of the efforts to encourage a wider range of people to become doctors and support the notion of medical education? Assemblyman, I guess you would be first here.
I'm not sure that that's part of the New York Health Act, but I think there are efforts being made. I think there are funding streams in general in New York to do just that. I think we could all agree that it's very important that people from all communities be represented in the medical field, particularly as doctors, nurses, and in other positions. And I think that's something that is being attempted in New York, and as it should be.
Okay, Senator, any thoughts on that?
I happen to agree with Assemblymember Dinowitz. I don't think that is the number one intention of the bill. However, what I do know is that the bill would actually reduce the cost that doctors spend, and so the totality of cost, which obviously doctors that spend less and don't have to pay for whatever extra costs exist, means that their overhead allows them to be able to provide more direct services to patients. That's an important part of this. So again, it's not direct about education or specifically even about getting more doctors into New York or into medical school specifically, but it does ultimately benefit doctors and the cost that they have. And honestly, if we're thinking about disparity of income, we know that people of color are in, when it comes to wages, the inequality of wages is incredibly disparate. And so this can be an unintended benefit of the bill.
My sense is when you focus on this and rearrange things and get people to look at things in a different way, all of a sudden these things will come up and they'll say, oh, wait a minute, if we're doing that, we may as well do this. I mean, it's kind of like a snowball effect. That's my own personal opinion on how these things work. And in a way, Senator, this came from Dan G in the chat. It's my understanding that several years ago, Vermont tried to implement a single payer's health system, which had problems but resulted in the plan being withdrawn. Are there lessons that can be learned from the Vermont experience? Not to necessarily put you on the spot, but are you familiar with what happened? And are there lessons that we can learn here in New York?
So I'm not specifically clear on what the exact reason was that it failed, but we talk about the Vermont system and structure failing a lot when we're talking about the New York system actually succeeding. So it's part of the dialogue. That's the first thing I'll say. The second thing is that when Gustavo comes on, I am sure, and I wouldn't doubt it for 1 second, that he and Assemblymember Gottfried have probably looked at the Vermont legislation very closely to see what actually went wrong and the circumstances around it. So even if it's not me directly doing that, I can pretty much 99% guarantee that they have done that. And even though the Vermont model failed, which by the way, was a really unfortunate talking point for those of us who were advocating for this bill for a long time, because being able to point to something that's similar in its name as a failure, it makes it easy to say, well, what makes you think that the New York Health Act is going to be any better? Well, here's the reality. We as New Yorkers always will take examples of things failing and making things better in New York, but also we have, again, California as a model. And I put the article in the chat for everyone. I can do it again, who recently is like literally one step closer to making this a reality there. And their state, as much as we know that New York is the center of the universe, which it is in so many ways, California's budget is much larger than ours. They have a bigger population. And so the risk that they will take doing this and making sure it's right is much bigger than New York's. And so that's a positive example, in my opinion, of how we can use their structure to get it even better here.
In a circular way, you have already precluded in a way what Judy mentioned in the chat, was that Vermont does not have the tax base that New York has. So, it could be that it could have been, I'm just supposing it could have been a financial issue. Assemblyman, do you have any knowledge of that?
I'm not 100% sure why it flopped in Vermont, but I will say this: sometimes it takes like economies of scale to make something work. And the population of Vermont, if I remember, is somewhere, it's less than half the population of the Bronx. Vermont is small. I love Vermont, but it's small, which means that the population of Vermont is probably, 3 or 4% the population of New York State. So it may have just been that it was too small for this to actually work. New York's population is around 20 million people. And I think we have, because we have that much larger base of people, of taxes, I would think and hope that we would have a greater shot at making this a success.
Assemblyman, this came from Ellen in the chat, and this is a very simple question. I think I know the answer, but maybe you folks have greater insight, and that is, what is the governor's position on the New York Health Act? Do you believe that all things being equal, it gets approved by the legislature and goes across her desk? She'll put the check mark on it. What do you think? Or a signature on it?
I have not heard the governor at any point say that she supports this or opposes it. I think ultimately, if this is going to start to take off, it's going to have to be the product of a three-way negotiation among the Assembly, the Senate, and the governor in order for it to happen. It's not going to be a thing like where the two houses pass it and then we just send it down to her and say, sign, please. It's going to really be negotiations amongst all three.
Especially given that she's going to run for re-election. It's an interesting concept. Senator?
Same. I have not heard her commit to this bill. I don't think ever. So I really don't know where she stands on this. But to the point that Assemblymember Dinowitz just made, this is not a bill that's going to happen without a three-way negotiation. So I just know it won't. It's impossible to have that happen without a three-way negotiation, because we need the executive, who has, until further notice, and we change this, the strong budgetary power to be on board. Because again, it's not just about the money from Washington, it's also about a funding stream from New York to be able to fund it. So it's going to take all three.
Senator, a little while ago, somebody said to me, what happens when you get older? What are the first three things to go? Are your teeth, your hearing, and your eyes? And what are the three things that are not covered? Your teeth, your hearing, and your eyes. So this question comes from Lauren, wants to know if dental and vision and hearing will be covered in the New York Health Act. Boy, I'm really hoping that's the case. So, Senator, I'm thinking that this would be among the biggest reasons why we want the New York Health Act, but you can weigh in on that.
Yes, the answer is yes. And that is the reason the answer is yes is because I think that all of us agree with you and what you just said. It's probably one of the most important parts, even when you're younger too, because dental insurance, as many of us all know, even if we have it, it's not sufficient to cover the costs of some of the things that we need, whether it's a root canal or a crown. I have been in this situation before, even with dental insurance, and it has been one of the most stressful experiences of my entire life. And I sat with the need for a root canal for almost a year during my entire campaign for the Senate the first time. And so that was not pleasurable. And it was really actually very painful. And I had to wait until I was fully elected to be able to even go to the dentist. And so, yes, that is in all of the things that you've just mentioned are in the bill. And it's particularly because of stories like mine and so many others that are even worse, that find themselves in medical debt and also find themselves not to even be covered for these things.
Or not to make a decision not to do it. I can only tell you firsthand, I would really love the cost of that to come down. and I'm sure there's many people who can relate firsthand stories. Assemblyman?
Those are three of the reasons why the New York Health Act would be great. Eyes, I forget which three you said, but vision coverage, dental coverage, and whatever the third one was. The point being that it covers everything.
Hearing.
And I got
hearing. Oh,
hearing.
Yes.
Maybe I didn't hear that part.
It could be.
You know what? I assume that the state senator and I both have the same healthcare coverage, and I have dental, and I use it, and it sucks. Our coverage sucks. It really does. It's terrible.
To be honest with you, unless you pay a fortune, everybody's does.
Yeah,
it's so bad.
It's better than nothing, but it's not so much better than nothing. And these are the things, especially when you do get older. You know, I mean, almost everybody needs to have vision coverage and dental coverage. You know, having dental, it's more than just your teeth. If you have really bad problems with your teeth, that could affect your overall health. It affects your heart. And it is so important that people have good dental coverage. And that's one of the things that the New York Health Act will do. I mean, that alone makes it a good reason to support, but it goes way beyond that.
We are going to expect Senator Rivera very shortly. We'll have Mr. Dinowitz step in here, offer a couple of words. The two elected officials and myself will take a deep breath while he's doing that, and then we'll bring in Senator Rivera.
Good afternoon, everybody. So you've heard our electeds tell you that what they need is for you to contact your representatives and the leaders of the House and the Senate and tell them that you support the New York Health Act. So we want you to call Speaker Hasty's office and ask him to bring the Health Act to a vote. It's Sunday, so you just leave him a message. The phone number is in the chat, and I'll read it to you now. 718-654-6539. Congratulations. As soon as you do it, you're an activist. Now, Please call Majority Leader Cousins also. Her number is 914-423-4031. And we're putting that in the chat too. Well done all. We also have some community announcements that we'd like you to be aware of. There's a bike ride being organized for April 9th from the Adam Clayton Powell office building on 125th Street to Speaker Hasty's office in the Bronx. We're going to tell you more about that. We'll send you some information about that later. Also, the Campaign for New York Health, the New York Health Act, is planning a rally in Albany, also in April, when we expect the bill to be brought up. Stay tuned for tabling and outreach opportunities in February and March. The Northwest Bronx Indivisible Candidates Forum for the State Assembly in the 81st District will take place on March 13th. The three candidates, Jeffrey Dinowitz, George Diaz, and Jessica Altagracia Wolford, will all participate. Please look for the registration in your email. Now, I'm not sure if our Senator Rivera has come in.
He
Right now,
has indicated that he's about to log in, so he will be here.
Okay, so then I'm going to
tell you a little bit
about him, just to delay it, and then as soon as he comes in, we can get going. Okay, Gary?
Sounds fine.
Okay, so State Senator Gustavo Rivera represents the 33rd Senate District in the Bronx, and he's the chair of the Senate Health Committee since 2018. In 2020, he organized and held statewide public hearings on the New York Health Act for the first time. And we're looking forward to hearing from him as soon as he comes in. Thank you very much to all our elected officials, Senator Biaggi, Assemblyman Dinowitz, and now Senator Rivera, for taking part in this forum and explaining things to us so well.
Well, he has actually just entered the room. So, Senator Rivera, nice to see you. As I understand, you just came down from Albany.
No. You are incorrect, sir. The opposite is true. I'm actually up in Albany.
Oh, you went to Albany. I had my directions wrong. Nonetheless, I think you have the floor. We've been discussing all kinds of details in the Health Act, and something you're working on, I'm sure, every single day. So maybe you want to just give us an overview of where you're at, and then we'll provide some questions for you.
Absolutely. First of all, thank you. Good afternoon to everybody, and hope everybody's staying warm. And thank you for your invitation to this forum. So the short version, I mean, obviously everybody knows what the Health Act, the New York Health Act is, right? A bill to create a single payer system in the state of New York, guaranteeing healthcare to every single New Yorker. And it is something that we're committed to doing, because we know that, and certainly everybody in this room, I'm sure, agrees that healthcare is a human right, but yet we don't treat it like that in this country. And so it's a bill that it's a politically complicated and technically complicated, but I do believe that we are on the way making some good progress. And I believe that this year is likely. I know that I will work to make that a reality. That this year is a year that we might get it on the floor. So I'll keep it real brief and simple so that you can ask any questions you might have. I'm sure that you have, that we can go from there.
I'm just going to ask one follow-up to that, because it did come up earlier. Do you want to give it a percentage? You want to say what the chances are, or what does it hinge on? Of course, obviously it hinges on votes. What are the stumbling blocks now that need to be addressed to get this across the finish line?
I'm not going to give you a percentage.
I knew you wouldn't.
You have to ask, though.
And the
thing is, this is what it hinges on. Now, we will definitely get into all the different details about different technical issues and political issues, etc. But I think that the biggest piece of this that everybody has to understand is that we are attempting here, and what we will ultimately achieve, but what we are attempting is to fundamentally reshuffle, reorganize the way that healthcare is delivered. That is not a small thing. The health insurance companies, as well as anybody who benefits from the current system, have for a very long time created this perception that this is the only way to do it. Basically, the whole concept is that the best that you could possibly do is just see if you can get the right job, because if you get the right job, you get the right insurance. It's all this mentality that the only way that healthcare needs to be delivered is to have an insurance product. That is something that is kind of as an underlying belief that is hard to break. And when you have people who are, who have been forever believing that the only way to do it is through health insurance, breaking that is difficult. Is what I call the bird in the hand problem. Right? This is the issue when we talk about organized labor. That's part of it right there. We talk about folks who have been able to secure something for themselves in any type of job that they do have or that they've been able to achieve. That's part of it there. I have this, and it might be crappy, but at least I kind of understand it. But you're suggesting something that I don't know if it's real. It's over there. Can it be real? That is the fundamental problem. That is not an easy thing to do.
That's a fascinating concept when you think about it, because then that becomes a kind of a marketing thing, a public education thing, as opposed to some of the specifics that we've been talking about. Senator, let's just get started with some of the questions that have been submitted. This came from Sandra Jenkins, who's a member of the Health Justice Committee of the Northwest Bronx Community and Clergy Coalition and Bronx Health Reach. This is fascinating, and in a way, I'm surprised that it hasn't come up yet. She says that my friends, my family, my neighbors do not have timely access to COVID testing and struggle to get tested after we've been exposed to COVID or even when we're sick with COVID symptoms. Can you share how the New York Health Act might affect our access to essential public health resources like COVID testing, or if God forbid we have something similar in the future that the public, everybody just needs and we can't have access to, or we can't find access to?
Well, what the New York Health Act would do.
And by the way, Senator, Christine Stanfield has green, and then at yellow, it's with 15 seconds left.
Oh, I'm sorry. I don't know where. Okay.
It's about
there's a lot of people. There she is. Okay.
Okay. Just so you know, we've been pretty loose.
Green is, tell me again. I'm sorry. Green is what, and yellow
green
is what?
Is just keep going. 15 is at yellow, and red is at goodbye.
Gotcha. All right. So the New York Health Act would completely, as I said earlier, redesign the way that we deliver healthcare. That means that everything related to how every institution that provides care would do so in a different way, because they would get reimbursed in a different way. When we began the pandemic, the concern that everybody had was like, if we get tested, is that going to be covered by my insurance? That was the first instance, right, that everybody kind of thought about, as opposed to saying, where is my nearest health facility, and just go and get tested. Because now everything is organized around sick care, not health care, really. It is all, I hope that I feel good, so I don't have to go someplace and visit a doctor, an emergency room, any other type of thing. So the way that it would work is that we would actually flip that on its head by guaranteeing primary care to everybody, and by more fairly reimbursing healthcare institutions that provide primary care and that are available. It would basically mean that everybody would have access to a primary care physician that they would know on a regular basis, and they would not just need to be sick to go to them. They would not think about going to them just when they're sick. And so this means that the entire infrastructure for healthcare would be reorganized, and it wouldn't just be about whether, I'm gonna hope that I don't get sick so I don't go somewhere. I hope that I don't feel like a cough so I need to go get tested. Instead, it would be something that would be just available. And we wouldn't have to figure out if who's going to pay for it, how much the cost of the test is going to cost, whether it's going to be covered, et cetera, et cetera. I'm still trying to figure out. That's a white. Is that
That's
yellow?
kind of yellow. The lighting changed.
Okay,
but you're okay.
He's holding up a white thing. I looked like anyway.
All right. I see that both Senator Biaggi and Assemblyman Dinowitz have their cameras off, so we're going to stay with you, sir.
Yep.
This is right up your alley. You would know probably better than anybody the answer to this one. The New York Health Act. This comes, by the way, from Gene Binder, Steering Committee Chair of Concerned Citizens.
Of course.
Change. The New York Health Act has enough co-sponsors to pass both houses of the New York State Legislature if they were brought up for a vote, and all the co-sponsors kept their commitments to the public. The lack of a vote on this bill stokes public cynicism. The bill is sitting in the Codes Committee in the Assembly and the Health Committee in the Senate. So let's start in the Senate. Why is it not moving out of the Senate Committee? I guess the Assemblyman Dinowitz can talk about the Codes Committee in the Assembly.
Because we haven't reached a consensus on what the bill on actually moving the bill. I mean, it's really that simple. Since the Democratic Conference became a majority, we have been able to achieve many things, and we have done so with many private fights that y'all never saw. Some of those conferences have been absolutely, drag out, fights, because we have an incredibly diverse conference, right? We have a diverse conference, and I'm thankful to say folks from all over the state. So we have folks from upstate New York, from rural New York, from suburban New York, et cetera. And we have folks who are anywhere from, crazy commies and actually card-carrying socialists to folks that are far more moderate. And therefore, the fights that we have fought, which have given us, whether we're talking about the taxation, the raising the taxes on the wealthy that we achieved last year, certainly didn't go as far as I would have wanted, but we managed to achieve it. Whether we're talking about the education funding that we were able to achieve when we fight for, the criminal justice reforms that we've done, et cetera, we've always done it by reaching a consensus within the conference. And we haven't reached that yet. In other words, there's some of my colleagues who are still not convinced that this is the way to go. So we are in the process, I continue to be in the process of building that consensus.
I asked this question to your legislative colleagues earlier, so I'll ask you the same thing. Is it a Democrat-Republican split on the code, on the Health Committee, and in the process of getting this passed? Neither Senator Biaggi nor Assemblyman Dinowitz thought it was. I'm curious, in your Health Committee, is it that kind of a split where it's very obvious red and blue?
There hasn't been a single Republican who has expressed their support of this bill publicly. There's been a few who I will not out, because God knows that I have been working on them for a while. When you have a couple of Republican colleagues, as I did after the pandemic, to approach me and say some things like, I just was like, they had a sense of how difficult it was for their constituents to be able to get access to any type of healthcare in the height of the pandemic. And they just were like, well, these institutions that are in my backyard and they're not well funded. And the conversations that we had have actually got me a couple of Republicans that have been somewhat softened in their opinions, but none of them have come out publicly. So the issue is reaching a consensus within the Democratic Conference. I mean, I certainly not only want my Republican colleagues to be part of this, but I insist to them that this is something that we're trying to do for every single New Yorker, regardless of who they are, what party they belong to, or where they are in the state, their wealth, their immigration status, et cetera. This is about fundamentally changing the way that New York does the work of delivering healthcare. So I would want some Republicans there. I certainly want all of my Democratic colleagues, but I don't have them all yet. And so it is about reaching that consensus within the Democratic Conference, and that includes within my committee.
I want to ask you this. I actually love this question, came through the chat. Carla asked, if the bill is brought to a vote and passes, is there an implementation timeline? This would be a huge change to existing healthcare infrastructure. And boy, there's a lot of people pretty well dug in this industry. Mm-hmm. What would it take to get it all squared away? I love that question. That's a very practical question. I'm sure, Senator, you've thought about it.
It absolutely is a very practical. It's a very good question, because as I stated earlier, this is not only politically complicated, but it's also technically complicated. We envision, and whenever I say we, be my colleague Dick Gottfried and myself, who's the sponsor in the Assembly, we envision a transition process of a few years. That means that even if we voted on the bill today, to create the regulations before the switch is flipped, we're probably talking about a couple of years. But just so that you understand, what we're talking about is, as we build up to that, it'd be like let's say December 31st of this year would be, the switch would be flipped on December 31st. That means that anything that happened before December 31st would be reimbursed in the same multi-payer system that we have now. And then January 1st, everything, every medical procedure, everything would be reimbursed in the single payer model. Because that's ultimately, by the way, all that we're talking about. This system ultimately what we're trying to do is we're actually trying to simplify it, and make it so that the bills are getting paid by one party, which would be the state of New York. That's all that we're doing here. And so for everybody that believes that, and that obviously would change so much, because if you ask any doctor, any hospital, or any person really about all the experiences that they've had with insurance companies and trying to make sure that that insurance company actually pays for the care that the doctor says that they should get, that'll tell you how much that is needed. But anyway, the process of transition would probably take a few years. And there is a board that would be a transition board. The bill creates a board for a transition and then a board for the actual operation of the system. And all that information is in the bill.
Senator, I'll ask you one final question, and if Senator Biaggi and Assemblyman Dinowitz are with us, we'll give them a chance to provide maybe a minute of final comments, and then we'll wrap it up. This came from Lauren. What do you say to opposers who assert this reorganization will ration care and possibly marginalize older patients and older adults? This is we hear this all the time. You're sentencing your senior citizens to a life without medical coverage. How do you convince your colleagues who are on the fence or opposing it that this is the way to go?
The first thing I would tell them is to take 2 steps back and look at the way the current system actually works for those seniors, right? And we can have a conversation about, we'll just focus on seniors for this conversation. And we'll look at how difficult it currently is for seniors to be well served. First of all, long-term care is something that doesn't exist except in long-term care plans, which are, it's long-term care is something that's included in the bill. That is a big piece of it for us, because we understand how important long-term care is to most folks. Because most folks will find in their families in the future, and maybe right now, they have need for long-term care and they do not have access to it. So they have to pay for out of pocket. If they have any type of long-term insurance plan, long-term care insurance plan, every single person within a long-term care insurance plan is a high-end user by default. As we understand insurance products, if you will, you have a risk pool. So you have one place where everybody puts a gallon of water in a pool for every month. And then some people need just 2 ounces and some people need 5 gallons every month. So it kind of balances itself out. So right now, the way that it works for whether seniors have access to services or not is a completely messed up system that doesn't give them access to all the things. For example, if you have Medicare, you still have to get Medicare Advantage plans to cover things that are not covered within Medicare. So if you just look at those 2 things, I would ask them, this is what I would ask my colleagues, to take 2 steps back and ask themselves about the current way it functions that has insurance companies at the core of it. And if you are happy with the way that works, where the medical decisions are made by I'm about to finish, that the medical decisions are made not by a doctor and you, but by an insurance company. If you're happy with that, the way it works for seniors and everybody else, then I got nothing for you. But the system that I propose completely changes that. And that is why it's a positive.
Thank you very much. Assemblyman, you want to take 60 seconds and just summarize what you've heard here today, and does it impact the way you will operate beginning tomorrow?
Sure. Well, as far as what was just said, Republican scare tactics have been around for many, many years, going back to when there was an effort made to pass Medicare back when I was a little boy. And, it's communism, it's socialism, it's this, it's that. Healthcare is rationed right now. You can't always get what you need under the current system. It's just, those are scare tactics. We have to get this done because if nothing else, we have seen exposed in the worst possible form the disparities, the unfairness, and ultimately the unequal health outcomes during this pandemic. And the New York Health Act is going to address all that, is going to make healthcare available to everybody, and is going to do that by creating massive efficiency, by eliminating the inefficiency that we have now. If we can get this done, this will be the most, I don't want to say revolutionary change because that word scares people, but this will be the most revolutionary change that we've done in New York, and it needs to be done. And I hope it's done. I hope it's done this year. I don't think we can delay any further.
You don't want to have another forum like this next year at this time. Senator Biaggi, are you there? Yes, looks like you are.
I'm here.
Nice to see you. And
Nice to see you.
maybe just take 60 seconds to wrap this up, if you would.
Sure. So I think that events like this are an important reminder that we have to continue to focus on the issues that we care about, not just in the same places with the same people, and grow the coalition. And that when it comes to issues as big as this bill is trying to address, the incredible focus and growth of our coalition is important. And so when we think about, again, I know I said this 4 times already, but I'm going to make it number 5, the coalition that is around the environmental justice package of bills, specifically the CCIA, and the coalition that is around the New York Health Act and other health initiatives should absolutely think of merging, because you cannot have one without the other. And those are 2 that I'm thinking of right now, but the point being that a lot of the issues that we're fighting about them in silos. And when we think about even criminal justice issues, we know that the people who are disproportionately impacted are people of color. And so we should be merging our coalitions and fervently going down the lane of get this issue done. We're all together, and continuing to focus on building the numbers and putting the pressure, but pressure in a way that I think is actually effective. And so I'm happy to always talk about that. But the long and short is that I am deeply concerned that if New York does not start to think seriously about the issues that we discussed today, specifically the New York Health Act, that we are going to find ourselves in a very dangerous situation. And we have the power right now to do something about it before it gets worse.
Thank you. Senator Rivera, you were last in. We'll give you the final word. Take 60 seconds if there's something you want to say that you haven't said, and then we'll wrap this up.
First of all, I thank you again for having this conversation. This is a conversation that we need to have. I would ask everybody to consider the way the current system works. And I think Assemblyman Dinowitz nailed it. He talked about the fact that these are problems that we have now. All the problems that you have now, I want you to think about them. I want you to think about the battles that you've had with insurance companies, the battle that your doctors had with insurance companies, the stories that you've heard about underfunding to hospitals and to healthcare systems. And I want you to think about how all those things have at the center of it the market mentality, right? The market, the idea that we should let the market rule here. We need to eliminate that. We need to take that out of it. Healthcare is a right. It should be treated as such. We do not do it in this country. And we do indeed need that revolutionary change. And I would ask you to then take the extra step and actually talk to your neighbors. And I'm sure that many of you do, because if you're part of this crew here, you're kind of natural organizers. This is the type of stuff that you do. So talk to your neighbors, then ask them to talk to their assembly members and senators. If you're in our crew, if you're in our neck of the woods, then you've already got us. But we're going to continue to take those folks who are just sponsors. We want to make them champions. And we need to push our colleagues to then have y'all demanded it so that they can become champions, so that we can get our leadership to help us move.
Among the many first steps here are having elected officials who are responsive. We thank Senator Alessandra Biaggi, Assemblyman Jeffrey Dinowitz, Senator Gustavo Rivera for joining us and supporting this concept so heartily. I will also very quickly, it's a long list, but think of all these groups and organizations that are partnering here. And I noticed, we had about just under 100 people in this thing, in this 2-hour forum on a Sunday afternoon with football on TV from the beginning. And normally these things, filter down and you get 60, 70. We've been over 90 the whole time. And that means that everybody is really committed to this. But we need to thank NYCD 16 Indivisible Mohawk Valley, Caring Majority Home Care, Domestic Employers Union Home Care, Point CDC Environmental Group, Diana, a religious environmental group, Cross Union Retiree Organizing Committee, New York State Teachers, United Teachers Union, United University Professions, New York Progressive Action Network, Northwest Bronx Community and Clergy Coalition, Bronx Health Reach, Concerned Citizens for Change, New York State Nurses Association, NYSNA, Grassroots Action New York, One New York State Indivisible, Physicians for a National Health Plan, New York Metro, Jews for Racial and Economic Justice. And I need to thank my buddies from BronxNet for putting this out live as it happens. And, that's exactly what BronxNet exists for. Thank you to everybody who participated. Let's turn it over to my colleague and friend, Helen Krim, who will offer some final words. Helen?
Hello.
There you are, somewhere out there. Everybody's got to go change their screen to find you somewhere.
Yes.
Go ahead.
Yes. I want to thank our elected officials for coming today. I do not know what happened, and I'm very concerned because Dick Gottfried was committed to come. And it is certainly not like him to not appear. I was in communication with his office last night. So I really don't know what happened, and I hope that he is well and nothing unfortunate has happened to prevent his appearance. I want to thank Gustavo Rivera, and Jeffrey Dinowitz and Alessandra Biaggi for pulling their weight through a lot of very technical questions for which they don't necessarily have the expertise that that Gottfried would have had. But you did beautifully, and I think that we're all a lot better informed about what is happening in the New York Health Act political and practical sphere. And I want to thank Northwest Bronx Indivisible for supporting me, and all of these organizations that when I started to do this, I was just overwhelmed by how many people participated, cooperated, sent in questions, and have been actively involved in this fight. And I think that we are in the process of forming a coalition that will be effective. And I thank them all. And I wish you all a very wonderful Sunday evening. I plan to have a glass of wine, as was suggested by Mr. Axelbach.
I said that? I would never advocate that publicly.
And thank you all for coming.
I would have two of them.
Thank you. And have a good evening all.
All right.